Come in. Hi, yes. My name is Tanya Little, and I'll be your social worker. And your name is?
My name is Kristen.
Have a seat. So how are you doing today?
I'm doing good.
Okay. Are you comfortable? Do you need anything?
No, I'm good.
Okay, good. So I was just kind of reviewing the referral that was sent over to me by DSS. And before we go any further, I kind of want to go over our confidentiality policy, just to let you know that anything that you and I discuss is confidential unless I feel that you're in imminent danger or your family is in imminent danger. Then I am mandated by law to report this. So do you have any questions?
No, ma'am.
Okay, if you could just review this and then sign and date it for me. Okay. I also have a consent for treatment. This is just allowing you. You're giving me permission to treat you today, and that's all it is. If you can just sign and date that for me as well. So while we're meeting, I'm going to be taking notes, if that's okay with you. And I just want to make sure that, you know, I'm accurate on the information that you're giving me. So I just like to take notes.
Okay.
So tell me what brings you here today.
Well, I'm coming here because I am having issue with my son. So he's not sleeping at night. He's 2 years old, and that makes me, when I don't sleep at night, because he comes in my home and he wakes me up every night.
Right.
So when I don't sleep good at night, I'm very irritable during the day.
Mm-hmm.
And that's why, I mean, I came here to seek some help because I don't work at my job now. My supervisor just called me up because I went to work and I was very irritable and I was angry, so I yelled at the customers.
Oh wow.
Yeah, so
I understand, yes.
yeah, so I mean, I just decided to come in and get some help.
Right.
Yeah.
So how long have you been feeling like this, or how long has this been going on?
Well, it's been now 6 months now, so yeah.
Have you talked to, do you have any support? Is your husband helping you out?
No, my husband, my husband is in school now and he's work full time, so he's not home. But the thing is, when he comes home, he wants me to cook, he wants me to clean, he wants the house to be clean, he wants his clothes to be nice and folded. So that had a lot of stress on me. Besides that, I don't get enough rest, you know. So it's very hard. I can tell you it's very hard.
Have you expressed to your husband, you know, just the stress and the anxiety that you're feeling because of, you know, what's going on with your son?
I told him that, you know, he's an African. As an African, this is what a woman does at home. So he doesn't understand it, you know.
Okay. So what are you doing to cope? How are you coping with this?
Well, I started drinking, you know. Yeah.
Okay.
I started drinking.
So how often do you drink?
I mean, every other day. It's just, I drink during the day. I mean, the other day I went to work and I was under the influence, so I started yelling at the customers, and it was really bad. So,
okay.
Yeah, they had to send me home.
Oh, they actually sent you home?
Yeah.
Wow. Okay. Do you feel at your job, are you able to explain to your supervisor, talk to your supervisor? Have you talked to anyone?
I mean, I talked to my friend. So my friend is the one who sent me here, but I'm scared, you know, I'm scared to say anything to my supervisor because I'm scared to lose my job. You know? Yeah.
Well, you know, some programs, you know, some jobs may have programs for people who are stressed out or, you know, or even drinking. So, you know, I would advise you to maybe kind of talk to your supervisor about that. There should be counseling, you know, some corporations do have that, you know, put in place. But in the meantime, as far as the drinking, do you drinking or do you feel that you're aggressive, you know, towards your kids and your husband at home?
Yeah, mostly toward my husband, you know. I yell at my kids. It's becoming more often now, so that's kind of scares me too because I don't want to harm them, you know. Yeah, my kids, I love them, but sometimes, you know. just tired. I don't know what to do.
Have you ever felt like harming them or your
No,
husband?
no.
Okay, good. Good. That's good. That's good. So, what about you? Sleeping. Are you able to sleep?
I can't sleep because like every 1 a.m. in the morning when I'm trying to get some rest, my kids will be coming and crying. He
Okay.
wants milk, he'll be crying until like 5, 6 a.m. in the morning, and then that's when he'll fall asleep. But then I have to wake up, I have to go to work, you know.
Mm-hmm. So what about other supports other than your husband? Do you have any other supports? Maybe family? Your mom or anybody that can kind of help out?
Yeah, my mom lives. My mom is here, but she's the one who take care of the kids during the day when I'm at work. So yeah.
Well, have you talked to your mom about his sleeping? Maybe it has something to do with, maybe he's taking a nap too late, and that's why he's not able to sleep in the evening. Have you talked to your mom about like when he takes naps at her house?
No, I mean, she told me that he sleeps a lot during the day, but I mean, I didn't know he should have an effect on his sleep at night,
It's a possibility. What about his primary care physician? Have you explained to your doctor your concerns about him not sleeping?
No.
Okay. But, I guess what we want to focus on is you and you're feeling depressed. Are you having crying spells or anything?
Yes.
How often?
Well, it's like, now it's almost every day because, I don't have enough help and I'm very tired, but then I have to do my housework and stuff like that, so I just cry a lot now.
Right, but you don't want to harm yourself.
No.
Okay. Okay, so I guess what'll happen next is, well, I guess first let me just kind of go over everything that you said. You're feeling depressed and overwhelmed. It's affecting your job. You've gotten written up, and I think your supervisor also sent you home just because you were drinking. You had been drinking, and then you were angry towards a client or a customer. And so, so it's definitely affecting, your everyday life. And what is it that you're hoping for? What are you looking for out of this?
I just need help. I mean, I just need some help to help me help my son. I just need to find out what I should do so that my son can sleep better.
Right.
And then if he sleeps better, then I'll get enough rest myself.
Right.
And then I'll be more efficient at work,
Right.
So, and with my everyday life.
Right.
Yeah.
So I guess what we can do, and if you need me to assist you, we can contact this primary care physician and maybe schedule an appointment. And just definitely let your primary care physician know what's going on about him not sleeping and how can he help. And I definitely too would talk to your mom about when he takes a nap and allowing him to sleep all day, because that definitely could affect him not sleeping at night. So the next step would be for us to just kind of schedule an assessment. I'll link you to one of our therapists, and what they'll do is they'll contact you within 24 hours to schedule an assessment, and then they'll go in more detail about really what's going on and how they can help you, and maybe they can refer you to a therapist who can assist you with dealing, just building your coping skills, learning how to manage your depressive symptoms as opposed to drinking. So that'll be the next step. Do you have any questions for me?
No, really.
Are you sure?
Mm-hmm.
Okay, good. So, like I said, you should be hearing from someone within 24 hours. And, in the meantime, I just wish you well. And what I'll probably do is just to follow up, just to make sure that someone did contact you and did, complete an assessment and they were able to assist you. So if you don't have any more questions for me, then thank you for coming in, and it was a pleasure meeting you.
Thanks.
Okay, take care, and good luck.
Thanks.